I'm just gonna, videotape this one.
So I probably, on this one, unless someone had spent a little time cleaning it up, I wouldn't differentiate that these are both kind of going towards the spleen here. So then you got to find one that's going to the stomach, which is this bag right here. So again,
Right there.
yeah, I think that's it. And then usually okay, so this is, it's not entirely clean, but gastric artery, splenic artery, and the hepatic is that guy, the third one. Can you see how there's three things there? But I mean, really, to be fair on a test, you want to have it clean so you can see where it's going. But celiac trunk is fair enough, that's for sure. I think it's fair enough to say celiac trunk. This is superior mesenteric, so those are fair. This is on the venous system, the suprarenal and renal. Again, I'm not saying it each time, but on the test, you might even just try to, make yourself each time left, right, artery, vein. So there's left renal vein and a little bit of the gonadal. It didn't get injected very well, but it's really clear on some of the cats. And then, let's see what you got over here. So this little kitty has, where's the poor little kitty's bladder? Because a lot of times you can trace, you go back from the ureter. It's just like, where happened to the bladder? This is the ureter, like going down to the bladder. This is a boy cat kitty, so these are the inguinal canal that kind of goes up from the scrotum and then passes through the body wall. So on this cat, there's a pretty good femoral artery vein on the left side, then deep, popliteal, sorry, not deep, popliteal artery and vein is behind the knee. The deep femoral, it cuts off right like at this inguinal region. So it's not really cleaned up here, so I probably wouldn't tag it on there. This is not the deep femoral, so this is like musculocutaneous or something. Not on the test. So what else can you see? You can see the iliolumbars. You've got going this way. You can see a pretty nice little fork in the road down here that you could tag. Remember, the cat only has external and internal iliac arteries. That you can see. You need to get in here, Haley, or can you see it? So this is, again, you have to say left or right, external iliac arteries, left or right, internal iliac arteries. This little nub right here, which we usually don't tag, but before it forks again, that would just be plain old internal iliac artery. The venous system on this one is underneath this, so it's a little hard to see. So I would use a different cat for that. So we did these already. So which direction here? We can go back up and see. This is on your little kitty here. This big old thing here is the thoracic aorta. Again, it's just not been dissected very well. So that big old thing there, and you can usually see coming off of it between the ribs and it's hard to tag them. We usually see that model over there. You can see the intercostal arteries are really clear, but you can see them on the cats. They're just not as easy to pin. So then you guys started with the celiac is the first thing that comes off of the aorta once it comes through. Superior mesenteric, I showed that already. Do you have an inferior mesenteric? It's this guy right here. Just not super well injected. See, there's something coming off of it. This is the aorta. And sometimes we leave all these nerves on there, but sometimes on the test to make something really clear, you literally just tear off the nerve so you can see the blood vessels a little better without competition. So on this kitty, you guys have got a nice, from the heart, this is the superior vena cava. And let's see here. Let's see if that's a vertebral. it's so beat up, it's a little hard to tell. This, I think, usually it's more in the midline, but this looks like an internal mammary or an internal thoracic, goes kind of up towards the body wall.
The boys have the mammary?
The boy kitties have, they call it the internal mammary, and the boy and the girl cats do.
Okay.
So technically yes, in answer. I'm not sure what to call that because, that one's not. This is going deep, and they're depending on which cat it is, the vertebrals come off of either here or further up. So that's why I was like, is that it or is that it? So I wouldn't tag it, but that's probably a vertebral on the left side, like this one. Does this one have one? Did you guys look? This vertebral is a little more typical, where it's coming off of after the branch here. So every cat's a little bit different. So you can kind of see on here, I'm showing it off of the Vena cava, but sometimes it's further up. So, but if you kind of lift and you go, well, where is that going? It's going down towards the vertebrae. So that's it showing further up on this one, but on that one, it's down on the Vena cava. So what else we got on this one? Just being, I said that mammary. So then if this is the Vena cava, then this branch here, these are the brachiocephalic branches. And then a pretty small little part of it, try not to break it, but is the subclavian. So, when all of this was intact, it's a little different looking, but the brachiocephalic, and then in here, it's subclavian. And coming off of that should be going up here is external jugular, is this guy here. The external jugular is the one that they use for injection, so there's some of it. And then coming off of the external jugular should be the transverse scapular. So, there it is. It's usually pretty big. So that little blue guy right there. So it looks like something that's going across, kind of like suspenders. That does get tagged on the test, but it's kind of hard to get the concept that thing is coming from this, which is the external jugular. So then, what do you got on this one here? So this is the external jugular. This is the little chin strap. So the transverse vein. And then, let's see, usually a lot of students think this is the branch to maxillary, but the maxilla is here. It's not down there. So it's usually further up. See, there's another branch here.
Oh.
Yeah, so the lingual towards the tongue branch goes sort of towards the middle, and then out towards the side is where the maxillary is. Let's see, did you guys see the azygos? You guys got azygos on there? So the azygos is that branch that you can see. Sometimes students think it's the Vena cava, but it is not, because it's way back against the body wall, and that often gets tagged on the test, the azygos. The inferior Vena cava is in between all this stuff in the lungs, and that's it right there. That's way bigger. Most of the cats, it's bigger. Let's see. How about, what do you got for arteries up here? So there's your aorta. So it's kind of going up and seeing where it goes. So a lot of this is, literally this could be, check this out, literally could be phrenic nerve there. A lot of this stuff is nerve stuff, and it kind of looks like it's going to the diaphragm. So there's usually a lot of nervous tissue going there. So I'm just saying that's why we kind of don't want to cut them all off. But this cat's not well dissected up here. So, but you can see the two main branches coming off of the aorta here in the cat. So the two main branches are on this side, brachiocephalic, and on this side, it's the left subclavian. So the brachiocephalic, a little further up, should have the branches to the carotids. So there's one. It just didn't inject very well. So that one I probably wouldn't use, but these are the two common carotids. They're just dirty is all. Those guys there. So how's this one any better? Well, there's one. There's a pretty cleaned up one. So there's a common carotid on the right side, and there's the common carotid on the other side, on the left side. So again, when they're not going to use a cat like that for that particular area, and if you're setting up a test, unless you want to spend like 12 hours, you pick the ones that are good on each cat and start pinning it. So, but this cat's maybe a little clearer up here. So can you see that a little better? So there's those two branches here. So the bigger one on the right is the brachiocephalic, and then this is the left subclavian. So the left subclavian kind of goes along here, and it should end up coming out this side. So like what, again, it's just somebody hasn't dissected it all the way, but there's the brachial, and if you cut through this and connect them, you can, trace the path. Look at this. So this is arterial there, and you should have something going deep down to the subscapularis muscle. Remember that muscle there? Ooh. There's a big guy on that side. There's the vein looks really big. See the subscapularis. So anything you see going deep and not following the path of the ones that go out to the arm, you could call that subscapularis. But I'm looking for there's the, again, because it's not cleaned up, I'm not tagging it here, but anything going deep there, that would be a fair subscapularis vein. And there should be an artery that goes down with it. So then going back here, so that guy came from here. The transverse scapularis or transverse scapular comes off of this is the external jugular on this side, and it's still there. And then you should have something coming off it and going over the shoulder. So not great on either one of these cats, so we'll have to go look and see if we can find a good one. Yeah, it's just not big enough to tag it on this side. So going across here, we should see a little better. We'll just rotate and see if we find one that's a little better presentation in here. Shall we look? See what else we got? Anybody got good? Got good.